So the thing that I like about um the aligned prosthesis or the aligned radial head, a couple of things, right? Number one, you can it starts out as a bipolar head that you then can turn into a monopolar head, right? So and the reason why that's important is because it gives you the freedom of flexibility to put that head neck angle truly and honestly with what we believe to be the anatomical form axis of rotation. And I think that's where Dr. Orbe and the team where they came up with the align, right? Because you have this alignment tool that helps you get to that anatomical point distally at the wrist at the ulnar fovea. And in doing so, I think what I have found is that, when I've got many of these patients that I'll get the fluoros intraoperatively, and I'll take those static views where you have a neutral, view and a fully supinated view and a fully pronated view. And at no point do I see that radiocapitellar joint not be in the center. And I think a lot of these other radio heads have done well in the market, like Ed mentioned earlier, and they've had some really good results. And but I think, as we unfortunately all encounter patients that are a little bit younger, I'm more inclined to do an aligned radio head prosthesis because of the fact that I think it's going to do less wear on the capitellum. Certainly, I think that makes a big difference, and it would just be, would need to be shown long term. But that's kind of why I like the aligned radio head prosthesis. Chandra, what are your thoughts on it?
Yeah, I agree with a lot of the points you made. I think this just gets me to a very reliable result. And
Yeah.
so most of the times we're treating these radial head fractures are with some combination of elbow instability. It makes a
Hmm.
lot of sense to me to have a stable radiocapitellar joint and stable proximal radius to then
Hmm.
help with the overall instability complex.